I think your video would be good if people can see you.
Okay.
Okay. So good morning, everyone. This is Sandeep Hegde. I welcome you all on behalf of Center for Advanced Studies and Policy Research. We are a think tank working in several disciplines. We are studying. We are into projects. We are into research. We are preparing reports. One of our report was employment has been considered by the RBI. And one of our initiative is to interact with the industry representatives and understand how they are dealing with this particular situation that we are having right now. And at the same time, we also want to provide a platform wherein students who are coming out of the institutions can understand what exactly is the scenario and what lies in front of them, and how they can possibly cope up with the things and manage to do whatever it required for them to sustain in this particular environment. So we are fortunate to have Mr. Rajeev Kher with us today. He's the founder, CEO of SaraPlast Industries, and he has the company is working in health and sanitation. So most of us are aware about the company and the products that they are having. So what we are going to do, we are going to have an interaction, and we would want it to be very open and very natural, free flowing. And in the form of discussion, we would take it further. We would also like to have participants to join in and ask their questions related to the topic, of course. And we would see that we can explore this particular aspect of health and sanitation in much more deeper way at the end of the talk. So I welcome Rajeev Kher sir, and thank you very much for joining in and giving your precious time to us today. And to begin with, I would like to ask you about the work your company has been doing in particular industry. Can you just tell us a little about that?
Yeah. So our organization has been around for a considerable amount of time now, almost over 20 years. And we started with portable sanitation, and we've been pioneers in portable sanitation, right from creating standards and quality sanitation in portable sanitation. We've been around for a long time, providing our services to various private as well as government organizations. And in the process, we have diversified into several other activities like FSM, which is one of the other areas that we're working very closely with Government of India as well. We have also branched off into several other areas, which is almost moving away, not moving away, but let's say moving from sanitation to preventative healthcare. And that is the way that myself, as well as our group, does see the entire industry moving towards. And with the onset of the COVID virus, I think this has become even far more necessary and far more essential towards creating a high quality of standards and services in this particular space. So, in whether it is providing buses which have toilets in them, or a bus with a COVID testing lab in it, I think both are equally important. And considering that sanitation and hand washing is the basis of all illnesses. They say 60% of illnesses happen primarily because of poor hand washing and poor sanitation habits. So I think given that as a background, we would like to really explore even more the opportunities that lie within this particular space of sanitation and hygiene. We have a considerable first mover advantage in this space, and have several accolades, awards, and firsts to our credit. But our main aim is to provide our services to each and every Indian in the country, to provide better quality sanitation and improved hygiene and sanitation standards to people in India. So towards that aim, we haven't even, I think, scratched 0.01% of the overall objective that we've wanted to. But considering the Swachh Bharat Abhiyan, which started in 2014, the awareness has substantially increased in sanitation, and we have got a considerable amount of a fillip or a boost really towards this particular space. And I think the awareness, because of the awareness, there's been a lot of positive competition. There's been a lot of complementary competition. A number of people have seen that sanitation is necessary, have looked into the objective of starting small companies and businesses. And as I foresee that this business will be a mainstream industry in the near future, although it is very, very fragmented as of now, the estimated business in the sanitation economy is pegged at about 60 billion US dollars in time to come in India alone. So you can imagine the potential that this industry of sanitation and the circular sanitation economy, what it has really to provide. One of the things that we have grappled with over a long period of time, and we continue to do so, is basically access to quality people and talent, because sanitation is looked upon pretty much as a stigma area, and not everybody wants to really work for a sanitation company. It is not on the wish list of young people, and most people look down upon such work and businesses. So the committed people and the really passionate ones are in this industry working with us and with several of our competition. And I think that is a beginning for a big, huge change that is bound to happen in India. And I think we are in the forefront of the coronavirus war by providing toilets and sanitation workers who are making sure that best services are provided to people in the space. So yeah, this is just the beginning, and I think a great opportunity for several young people to even be a part of this business ecosystem.
So before moving on with the challenges that the companies like you are facing during COVID-19 and lockdown, I would like to know a little bit more about your company in terms of, while researching, we have seen that it was started with merely 2 blocks, and rest is history, as we call it. And your company has also worked during the Wari, Pandharpur Wari. So can you tell us a little bit more about that particular initiative of yours?
Yeah, so yes, we started with just 2 toilets and conviction and hope. And those were very essential towards creating a successful business model. Over a period of time, we got invested by venture capital funds, a social impact fund, and then by one of the world's largest impact fund, which is Swiss-based. And recently, our company has got partially acquired by a multi-billion-dollar Indian multinational also. So we've moved absolutely from scratch to creating a large business differential in really our space, so to speak. We have done several large events, including the Kumbh Mela. We have done the Pandharpur Wari. We were pioneers in actually doing the Pandharpur Wari along with a social organization called Seva Sahyog. And we provided, I think, about 4,000 toilets at that point in time to the 1 million odd Varkaris who travel from Anandi to Pandharpur. And this was a pioneering effort by these 2 organizations, ours as well as Seva Sahyog, and with the support of the Zila Parishad and the government and the Maharashtra government, to really create a zero open defecation situation where literally none of the Varkaris and none of the people in the Wari had to sort to open defecation, which reduced substantially the number of illnesses and diseases that would spread typically during this Wari period. So similar kind of results were seen in the Kumbh Mela in Nashik, and there was a similar one seen in Ujjain, and several such events which have taken place have substantially reduced the epidemic, or let's say the possibility of viral as well as airborne epidemics in that particular area. As you well know, in Pandharpur and even in Anandi to some extent, Pandharpur more so, there was a time when one of the government officials told me that even when they measured they took air samples and there was E. coli bacteria in the air. And today, if you see, there have been several articles, several testimonials from the Varkaris as well as government officials that today Pandharpur is absolutely clean. There is not a single case of open defecation. and the toilets have been placed all along, in the backside of the temple and in a very clean area. The entire area where people used to go for open defecation is a very clean area where today people have been literally camping and lying down and setting up their mats and having lunch and breakfast over there. And I think that for us is a big, huge impact that we have created. Similar kind of impacts have been created even in slums. We have provided toilets in slums. Now in Delhi, there is a big slum called Anand Vihar. And we had provided, we did an exercise where we provided toilets in Anand Vihar and a space which was completely used for open defecation. A big ground that was used for open defecation in 2 months' time was converted into a playground for children to play cricket. And there was almost zero case of open defecation in that slum, which is today, even as of today, is one of the largest slums in Delhi. So you can see the impact that good quality standards of sanitation, a combined effort by stakeholders and government and the entire workforce working together, the kind of impact that it creates. And our organization really specializes in working with people, working with teams to create this impact. So we're not just a mere sanitation services provider. We are a change maker, and we are an organization that believes that the future is not just sanitation and not merely open defecation reduction, but it is changing the lives of people to make their lives better.
Right. So certainly, sir. So I would like to announce one important thing, that we want it to be a discussion. So anyone who is willing to participate or have any questions, if you can write down your questions in the chat box, if you can raise your hand, so we would unmute you, and so that you can participate in the interaction. So moving further, now since this COVID-19 has forcefully taken our attention towards the sanitation and how it is important in our lives. So do you think that, and one more aspect that you just mentioned was about you're drawing a good amount of investments in your company through multi-billion industries in India. So do you see it going further without any hurdles now with this COVID-19 impact, the industry in particular?
Actually, COVID-19 definitely has been a major factor to pull down a lot of growth, let's say the speed at which it's growing. But see, please bear in mind that sanitation and health are in fact going to become even more prime and going to become a bigger focus now. If you see the utilization of hand sanitizers, hand washing, I think that itself gives you a clear idea of what the future has in store. And as we see it, this COVID-19 virus is not going to go away in 1 or 2 months. It's here to stay, and it's here to stay for a long time. And we have to make changes, and probably have to go back to what our elders and our people of the previous generations mentioned to us, is basically as soon as you come home, wash your hands, wash your face, and then probably have your lunch or whatever it is. So we will have to follow a certain amount of discipline. But having said that, it gives us an opportunity to explore a lot of other businesses. For example, what I have a couple of points to make towards this. One of the things is that smaller businesses, so small and medium enterprises in this space, have a large potential to contribute towards this particular business model. So to provide, let's say, a back end or a background support to the COVID virus. And I think a large amount of collaboration is going to be needed, which will be extremely beneficial or symbiotic to the large companies as well as the small companies. So the large and small private sector partners need to collaborate with the larger corporations and larger companies to go piggyback with them to really get to the last mile. And I think that would be great. And a small example would be, let's say, a smaller company goes piggyback with a Unilever with a product that could be useful and beneficial to the last mile, where, let's say, a Lifebuoy soap is sold. So this could be an example of distribution to the last mile by a smaller company to go piggyback with a larger company. And I'm sure that these companies are also looking for such kind of opportunities to reach out to various inroads in the remotest parts of India. The other thing is that there needs to be a lot of research that needs to be done, whether to see if about product safety and the use of products that are provided. I mean, there is no such proof as of now or exact research whether fecal matter is one of the prime proponents or whether it can increase the extent of the coronavirus. So considering that there could be a possibility of that, I think we need to take into consideration also safe disposal of waste. So there is a great opportunity even in septage management and fecal sludge management where waste can be disposed of in the most hygienic and most scientific manner as per international standards. And in fact, this is one of the standards that has been very clearly defined by the WHO recently in one of their documents that they've released. The other thing is the opportunity of smart sanitation. And I think smart sanitation economy is something that's going to be really big in India. It can go hand in hand with the smart cities initiative that the government of India has. So, for example, how can you let's say find out the possibility of an outbreak of an epidemic by using electronic and smart smart technologies, and have some kind of, so for example, an example is this Arogya Setu app. This is one of the examples of smart and connecting it with the sanitation and hygiene sector. Similar kind of things can be done by providing sensors, providing some kind of technology in drains and in plumbing systems, where you'll be able to find out the extent of the viruses and bacteria that are flowing, and you might be able to stop an epidemic or stop the outbreak of an epidemic even in a small area to control it. So I think multiple opportunities are available in this smart sanitation space, or whether it's the disposal and transportation of sewage and waste. I even spoke about the product delivery mechanism where you can go piggyback with a Unilever, for example. And the other area is financing. I think there are large organizations like Unilever has a wing called Transform, which is along with the DFID, is definitely looking at putting in a certain amount of money in the sanitation space towards development. Even UNICEF has an ICRC fund, which is also right now is active for people to uptake this fund if it's possible. And if I'm not mistaken, USAID has an economic support fund as well as ADB. ADB has, in fact, Asian Development Bank has a special COVID fund. So if there are companies that want to look at applying for these funds or getting into this, we would be happy to address this. I'm a part of the Toilet Board Coalition, which is based out of Geneva, which facilitates sanitation economy, and would be happy to even help companies reach out to various organizations such as the ADB and also ICRC. And this could lead to a large revolution in smaller companies being a part of this entire effort towards supporting COVID. So COVID is not just providing the viruses, the antivirals and the medications and the PPE suits. It's also this back-end hand wash sanitation area, which is a very, very large and very long-term impactful space, which smaller companies can be a very active part of. The other thing that I strongly believe is that there needs to be a lot of innovation and a lot of leapfrogging effort in innovation in finance and also in basically access to sanitation. So there needs to be a lot of space, a lot of scale that needs to be developed for toilets. If you just see Dharavi, for example, in Mumbai, the population of Dharavi, to cater to that, you will need thousands and thousands of toilets. And as per the WHO guidelines, you have to have toilets which have to be absolutely sealed. You have to make sure that the waste doesn't contaminate with the outside area, or the drain pipes are properly sealed where the waste is taken to the sewage treatment plant. Now, if you see, there's a huge opportunity here to provide portable toilets here in Dharavi. There's a large opportunity to provide a cleaning facility here. So, you have to see the effort in how you're going to scale, and leapfrogging and finding solutions for scale will be a very, very big area towards improving not only the hygiene standards, but also from a business model perspective, it could be extremely useful for small and medium businesses. And I think leapfrogging finance is basically, the Pune Municipal Corporation a while back had done a kind of an impact, had done a bond in the city of Pune towards raising some funds. And I think development impact bonds for sanitation are widely available or can be accessed. And I feel that something like that could enable a lot of smaller companies to get access to large financing and funding towards creating this differential advantage of sanitation and hygiene improvement towards the larger aim of, let's say, COVID or other illnesses and other viruses that are prevailing in the country today. If you know that even a diarrhea, for example, is killing thousands of people every day. So this will also reduce the instances of people that are dying of illnesses like diarrhea, and to add to it, of course, the bigger menace of things like COVID. So for me, I believe that it is necessary to look at some innovative and leapfrogging efforts to really creating that change towards making an impact in this particular space.
Right. So that was great information. But when you talk about small businesses, do we have any space for startups? We are having so many youngsters connected to us, and as I mentioned in the beginning, that they'll be out of the institutions in this year during this year. So they may venture into that. Even there are some NGOs, there are institutions like us. So do they even have any space to play in it and get some fundings from the institutions that you have mentioned, like ADB, etc.?
Yeah, absolutely. I mean, there's a large amount of research. I mean, I just mentioned to you that that there is a large potential for research partners along with the private sector to address this particular space. And the World Bank, the Asian Development Bank, UNICEF, they're all looking at see what you need most when you're creating such a kind of a change is you need evidence. And evidence-based reporting is extremely crucial towards doing any decision or decision making for a larger corporate body or a municipality or whatever. So there is a lot of research required, and there is a lot of space for research-oriented areas. In fact, our company, as well as many other cohorts which are a part of the Toilet Board Coalition, would be very happy to collaborate with organizations like yours and with smaller partners and startups to even become a cohort or a part of a development organization which could lead towards making small changes in the areas. And they could find funding, they could find grant funding, and also support it for getting equity or some kind of debt funding at very, very low rates or rates which could be very beneficial to creating business models for these people. So there is a lot of potential for research. There's a lot of potential for startups, and I would be happy to facilitate this with the organizations that I'm a part of. And as I mentioned to you, that the Kalyani group has invested with us, and we are looking at creating a center of excellence along with an innovation lab. And this could be a great area for collaboration for smaller organizations and also for the larger research-oriented organizations to be a part of. So we would welcome anyone to be a part of this.
That is fantastic. So that shows some ray of hope for many of the companies who are struggling in these times, and even for us who are willing to work in areas like health and sanitation. So thank you very much for that. So we would definitely see some way out and some collaborate and do something with your help. So taking it further, you just mentioned about innovations. So can you just elaborate on what kind of innovations we should be expecting from education industry or anyone who for this particular industry?
So I think I think innovation. If you talk about innovation, I think innovation is the key towards creating a change in the times of people. And I think in this space, the amount of innovation done was very, very low as compared to many other areas, primarily because sanitation was not considered as a priority area. It was not considered important enough to have its attention to it. Now with illnesses like COVID and all these things which are happening, I think that people will understand the importance of hand washing and sanitation much more than what they did before. They will take it far more seriously. And if you have recently seen, everybody wants to sanitize their areas. They want to make sure that toilets are clean. They want to make sure that what kind of small areas, but they want to make sure what is the kind of chemical that you use for cleaning. So there is a lot of attention to detail now for hygiene related issues of hand wash and sanitation. And there's a lot of innovation that is expected in the time to come, especially from technology side. And I think smart sanitation is one of the big areas which will be able to really it will be path breaking to really see what kind of innovation is happening. I mean, just to give you a small example, and I mentioned it earlier today, that um, we are moving we're not only in sanitation, but we're moving from sanitation to preventative healthcare. So you can expect COVID testing buses. You can expect these diagnostic mobile systems. So you are looking at a toilet really being converted into a diagnostic center or into a testing center, because ultimately at the end of the day, pathology and body fluids are what are required to really find out and test about your illnesses and the status of your health. And I think this is exactly the one of the areas to take very seriously to in the near future. And innovation in this particular space will provide a very important aspect. Just to give you a small example, like we are doing something in Pune with this T-bus, which is a bus which has been converted into a old municipal bus that's converted into a toilet. Plus, there's a big area of menstrual hygiene, which we haven't really touched upon, but that also is a great part of the sanitation economy. And menstrual hygiene and women's and space for women is something which we have been focusing on, and we have a team that is dedicated to this specific area. So this bus is not only a toilet, but it also is a space for women. It's a privacy space, and also an area where a woman can go inside the bus and she can have a video. She can see a video and do a self-examination for her breast cancer if there is a possibility, or we are even looking at doing some kind of diagnostic tests for cervical cancer inside these buses in time to come. So it's just a question of getting some licenses. It's question of getting the right kind of training and the right kind of people on board so that this can become successful. So it is absolute innovation and taking it to another level. And this is something which has been key for our organization, has been that we've been very innovative in this space, and we don't consider ourselves only a toilet company, but we do consider ourselves a company that's changing the lives of people in India. So yes, innovation is crucial, and I think I would urge people to look at innovation very closely and look at coming out with new ideas. I think the country needs these new ideas, and the world needs these new ideas.
Right. So very rightly said, and you mentioned the aspect regarding women. So I believe there must have been some ignorance or some resistance from the society itself while handling these kind of aspects of sanitation regarding women. So now when we are having the whole of the world closed down and sitting in their homes, so do you see a good response from the society like India towards these kind of initiatives when you're having a bus or a video playing for women so that they can have the inspection for their breast cancer? So do you see your response would be changing, and it would be changing positively from the society towards these kind of initiatives?
Absolutely. I mean, okay, for now, everything is shut and you're not allowed to go onto the roads. But, once people start venturing out, we will make sure that our buses are sanitized. We make sure that they're absolutely viral free. And we use the kind of environmental solutions which make sure that there is no contamination in these buses. And ladies can very comfortably and freely operate inside these buses. They can in fact, we have even created a space for breastfeeding for women with infants. So definitely there is this is changing, and I can see it change over the last few years. And there was a considerable amount of ignorance, and even if you see the habits and the overall acceptance, when we were a little younger, maybe about 15-20 years ago, if you went into a medical shop to buy sanitary napkins, for example, they would wrap it in a brown paper, wrap it in newspaper, almost like they're giving contraband to you. Now they will it's very open, and in fact so much so that even my daughter would tell me that Dad, while you're coming back from work, can you pick up so and so type of sanitary napkin from the medical store and bring it for me? So there's a large amount of awareness that's created, and society is changing. Women are also becoming a lot more empowered. They're becoming a lot more, they're voicing their opinions about what they want. So this is something which is a big change, and talking about gender equality, talking about women empowerment.